Hello lecturers and fellow classmates. Ever wondered what happened to the 30-year-old female who had a liver transplant after not feeling so well at the dinner dance gala event? Today, our team will be delving in as to what may have happened. This is brought to you by Team Lost Grapes, consisting of Irvin, Chloe, Bethlyn, Shamira, and me, Ziyi. This is what we'll be covering for this video. So what are the differential diagnoses? After hours of thorough researching, we believe that it is likely to be acute hepatitis A, followed by an onset of autoimmune hepatitis. We will also be covering why alcoholic hepatitis is not likely. What is hepatitis A? Hepatitis A is a viral liver disease caused by an infection in the liver with hepatitis A virus, in short HAV, which is a non-enveloped RNA virus classified as a hepatovirus under the Picornaviridae family. However, unlike hepatitis B and C, HAV does not cause chronic liver disease. How does HAV spread? An individual can get infected from ingesting food or water contaminated with feces of an infected individual. In other words, its mode of transmission is closely associated with unsafe water or food, inadequate sanitation, poor personal hygiene, as well as oral, anal, sexual intercourse. How does one know that he or she has HAV? Signs and symptoms of HAV may or may not appear, but if they do, they'll only appear a few weeks after infection. Such symptoms can range from fatigue to intense itching, lasting from 2 weeks to 3 months long. In this case, she exhibited fatigue, nausea, abdominal pain, fever, and jaundice, which appeared after 2 weeks and persisted for 3 months, coinciding with the symptoms of HAV and their duration. Delving into the clinical features of HAV, a few weeks after infection, it is observed that there was an elevation of levels of liver enzymes, serum bilirubin, as well as alkaline phosphatase. A positive result of anti-HAV IgM antibodies is also of clinical significance, indicating the recent infection of HAV, all of which was exhibited by the patient. Pathogenesis. Firstly, upon ingestion of contaminated food or water, the virus circulates in the bloodstream to the liver. As virions enter the hepatocytes, viral replication occurs, causing necrosis of liver tissues. The viral growth also stimulates the body's immune response, producing anti-HAV antibodies. After 8 to 10 days, the virus is excreted in the feces, accompanied with symptoms like jaundice and nausea. In addition, HAV increases the risk factor of other diseases, like autoimmune disease. Can one recover from HAV? Often, full clinical and biochemistry recovery can occur within 2 to 3 months, and complete recovery in 6 months. These recovered individuals can develop immunity against HAV. However, relapses do occur, especially in patients who resume drinking or exercising. In severe cases, fulminant and subfulminant hepatic failure can occur. This is a development of severe acute liver damage accompanied with encephalopathy, which is the altering of mental state. This is common amongst older people as well as individuals with other liver diseases. These patients often require liver transplants. Now, Chloe will share with you about autoimmune hepatitis. Chloe, please.
Thank you, Ziyi. Now let us all take a look at autoimmune hepatitis. Autoimmune hepatitis, AIH for short, is a condition whereby your immune system mistakes your self-liver cells for foreign aggressors and thus creates antibodies to attack the body's liver cells. These immune attacks are characterized by circulating autoantibodies and elevated serum globulin levels. AIH is a chronic condition that can lead to serious damage to your liver, typically inflammation, cirrhosis, which is the scarring of the liver, and eventually liver failure. So how can AIH be contracted? AIH is believed to be due to a combination of environmental, genetic, as well as immunologic factors, but the etiology or the exact cause of AIH presently remains undefined and unclear, waiting for budding young scientists like you to tell us why in the future. There are several risk factors that have been identified that increases the chances of contracting AIH as shown, such as being a female, having a history of certain infections, or even hereditary. Fun fact, AIH actually affects females 4 times as often as males. There are 2 types of autoimmune hepatitis diseases. The type 1, AIH, is more common and is usually diagnosed in adults. About half the people with type 1 AIH have other immune diseases as well. On the other hand, type 2 AIH is less common and is usually diagnosed in children. Other autoimmune diseases may accompany type 2 AIH. Here are some common symptoms of AIH as shown. Many of the symptoms the patient exhibits are similar to that of autoimmune hepatitis patients. AIH ranges from asymptomatic to symptomatic onsets, fulminant, acute, and chronic. The signs and symptoms of AIH varies amongst patients. Here are some significant clinical features of AIH. Many of these features, and even the most prominent ones, such as the presence of autoantibodies, AIH histology, as well as the lymphocyte loss, were present in the patient. When diagnosed and treated early, AIH can be controlled with drugs that suppresses the immune system. If AIH were to be detected late and kind of go untreated, it can result in permanent cirrhosis. Some complications of cirrhosis include enlarged veins in esophagus, accumulated fluid in abdomen, as well as liver failure and liver cancer. Now, allow me to pass the time on to Beth and Shah.
Thank you, Chloe. At the first look of the symptoms presented to us, alcohol hepatitis seemed to be one of the possible diagnoses that could be given. However, with closer observation, we concluded that it was not, but rather it was highly possible for her contracting it in the future, considering the state of her liver. Alcohol hepatitis is the inflammation of the liver due to excessive long-term consumption of alcohol. In the patient's case, it was only an episode of binge drinking. Alcohol hepatitis is commonly associated with a fatty liver, an early stage of alcoholic liver disease, which may contribute to the progression of fibrosis leading to eventual cirrhosis. It can be further aggravated by binge drinking and ongoing alcohol use. On the right are some risk factors such as age and amount of alcohol consumption. Here are some symptoms of alcoholic hepatitis. Some overlap with other liver diseases. Symptoms include nausea, vomiting, and jaundice, which was exhibited by the patient. Next, I'll be passing on the time to Shamira.
Thank you, Beth. Moving on, these are the clinical features of alcoholic hepatitis. If someone develops alcoholic hepatitis, there will be elevated liver enzymes level. As for the histologic changes, there will be presence of microvascular steatosis, balloon hepatitis, and lastly, the presence of malarial bodies, which is common in patients who develop alcoholic hepatitis. In conclusion, the symptoms portrayed by the patient are similar to the three diseases as mentioned. However, after further diagnosis, the patient is unlikely to be suffering from alcoholic hepatitis as the patient has no history of being alcoholic. Instead, we think that the patient was diagnosed with HAV, as the patient exhibits similar symptoms and most of the clinical features such as elevated liver enzymes. HAV usually presents as an acute infection and does not have a chronic clinical form. Also, less than 1% can develop liver failure from HAV. Thus, her liver failure was likely to have resulted from autoimmune hepatitis. Since the lady has had a history of HAV, she has an increased risk factor and higher susceptibility of developing autoimmune hepatitis. Moreover, she also displays signs of autoimmune hepatitis, such as presence of autoimmune antibodies, which further assures our deduction that she has acute hepatitis and subsequently autoimmune hepatitis. Now, I'll pass to Irene to talk about the viability of liver transplant.
Thank you, Samira. I'll now be taking the time to address question 2, which is whether it's viable for the young female to undergo a liver transplant. Before that, let us look at the different types of liver failures. First and foremost, we have acute liver disease. Acute liver failure is a liver disease that produces hepatic encephalopathy within 6 months of the initial diagnosis. The condition is known as fulminant liver failure, and when the encephalopathy develops within 2 weeks of the onset of jaundice, and a subfulminant liver failure when the encephalopathy develops within 3 months. Next is chronic liver disease, where most patients will suffer from cirrhosis, which is the diffuse transformation of the liver into regenerative parenchymal modules surrounded by fibrous bands. Cirrhosis is a morphologic change most often associated with chronic liver disease. And last but not least will be acute on chronic liver disease, where some individuals, after years of stable, well-compensated chronic disease, suddenly develop signs of acute liver failure. Since the young female experienced encephalopathy within 3 months of the onset of jaundice, we can assume that she was suffering from subfulminant liver failure, a form of acute liver failure. To further prove our point, acute liver failure manifests with symptoms that can be seen in the young female. These symptoms are typically followed by the onset of life-threatening encephalopathy, coagulation defects, and portal hypertension associated with ascites. Typically, transaminase levels in the serum are also elevated, which can be seen in the young female's high level of AST and ALT. The liver is also initially enlarged by swelling and edema related to inflammation, which are seen in the young female. As the parenchyma is destroyed, the liver also shrinks dramatically. Eventually, as hepatocytes are lost, serum transaminase values off and then decline rapidly as their source declare. disappears. Based on her severe condition, a liver transplant is needed to prevent death. However, there are some other considerations to take before fully deciding that a liver transplant is viable. These include the survival rate and chances of reoccurring autoimmune hepatitis, IH for short. For patients suffering from AIH, the 5-year survival rate and 10-year survival rate after liver transplant are 88 to 90% and 75% respectively. Or reoccurrence in the transplanted organs occur in 20% of these cases. More complications include the difficulty in finding a liver donor, both living or deceased. Living liver donors go through extensive evaluation to ensure they are matched with the organ recipient and to assess their physical and mental health. In addition, the wait for a donor liver can vary greatly. Some people may wait days, months, or may never receive a deceased donor liver at all. Lastly, a liver transplant also costs a lot of money. Liver transplant procedures are estimated to have an average cost of $577,100. In conclusion, we feel that a liver transplant is viable, as the liver transplant is considered to be the only therapeutic option for those with liver failure due to AIH. Despite the 20% risk of AIH reoccurrence in the patients with a transplanted liver, it is still crucial for the young female to undergo a transplant, as the situation might worsen, even resulting in death. Even if she suffers from AIH again, patients who develop de novo AIH do not have a satisfactory response to standard anti-rejection regimes, but they do respond to the standard treatment for AIH, in combination with a low dose of calcineurin inhibitor. The survival rates after a transplant is also high. Since her situation is dire, she will most probably be placed high on the priority list and will not need to wait long for liver donor. As such, a liver transplant is much needed. I'll now be passing the time to Samira.
Thank you, Irvin. I will now be taking the time to address about the lifestyle and medical management for this patient. Currently, for HAV, there are no specific treatment or medication to cure the infection. Instead, supportive treatment is given to improve comfort levels and to prevent complications. As for the lifestyle management, there is needed for some changes, as HIV can be transmitted to others. Thus, the patient should try to use a different bathroom if possible and wash your hand in a separate sink to reduce transmission. Also, laundry and bed liners should be washed separately in hot water with disinfectant. Now, I'll pass the time to Beth to talk about the lifestyle and medication management for autoimmune hepatitis.
Thank you, Shamira. There are mainly two medications for autoimmune hepatitis, glucocorticoids and azathioprine. An example of glucocorticoids is prednisone, which controls inflammation of the liver, preventing further scarring. It carries along side effects such as weight gain, bone loss, and high blood pressure. Budesonide may be substituted for prednisone for patients without cirrhosis. The second medication, being azathioprine, is recommended in addition to prednisone, as it helps minimize the potential side effects prednisone brings. However, it still has some side effects such as allergic reactions and low white blood cell count. As for lifestyle, there is no drastic change, but the best advice is to eat a normal, healthy, and balanced diet to avoid being obese, as well as abstaining from alcohol. Next. Therefore, our group concludes that the 30-year-old female has a differential diagnosis of acute hepatitis A and autoimmune hepatitis. It is also viable to have a liver transplant carried out, as it is the only therapeutic option despite a 20% risk of recurrent AIH. The medical and lifestyle changes, as mentioned above, should be followed closely so as to avoid the situation. Thank you.